What if I told you that the position you choose to sleep in tonight could be quietly stealing years from your life, sapping your energy, stressing your heart, and wearing down your brain so much so that new research shows certain sleep postures can raise the risk of stroke, memory loss, and chronic pain by more than 60%? It sounds shocking, but scientists at the National Institute on Aging and sleep experts around the world are now saying it isn't only how long you sleep that matters, it is how you lie down. For millions of older adults, sleep has become a nightly battle, tossing, waking sore, breathing shallow, and rising exhausted. What many seniors don't realize is that a comfortable habit, curling up, propping in a recliner, or lying flat with no support can, over months and years, quietly compromise breathing, restrict circulation, irritate the spine, and rob the body of the deep restorative cycles it needs after 60. Tonight we're going to expose the 4 worst positions you should avoid, and the 4 safer, healing positions that can restore energy, protect your spine and heart, sharpen your thinking, and help you wake up feeling decades younger. So stay with me, because this may change the way you sleep forever. And if you haven't already, tap subscribe and hit the bell so you don't miss science-backed tips designed for people over 50, and drop a quick one in the comments if you re-watching so I know you re-here. First, sleeping flat on your stomach face down can feel cozy and familiar for many, but for seniors, it is quietly brutal. Turning the head to one side for hours twists neck muscles, compresses nerves, and reduces blood flow to the brain, leading to chronic stiffness, headaches, and numbness in the hands. Pressing your chest into the mattress limits lung expansion, forcing shallow breathing that reduces oxygen to your heart and brain and can raise overnight blood pressure, while added strain on the lower back accelerates wear and tear on vertebrae already vulnerable to arthritis or disc problems. So, while stomach sleeping may feel restful at first, it often steals comfort and function one night at a time. Next, the curled fetal position, a tight ball with knees to chest, may seem protecting and familiar, but it compresses the diaphragm and chest, decreasing lung expansion and encouraging shallow, rapid breaths. For older lungs, this means less oxygen, morning fatigue, headaches, and added cardiac strain. Curling also locks the spine into a C shape, shortening the muscles and ligaments that support posture, worsening spinal curvature over time, and making you stiffer and more prone to falls. The very isolation of movement it promises to ease becomes the thing that silently shrinks your posture and balance. The old soldier posture, flat on your back without proper support, was once praised for alignment, but for many seniors, it opens the door to obstructive sleep apnea. Gravity allows the tongue and soft tissues to fall back and block the airway. This causes repeated pauses in breathing, gasping, and oxygen drops that increase risk of stroke, heart disease, and cognitive decline. Lying perfectly flat also worsens acid reflux by letting stomach acid travel up into the esophagus and throat. This leads to night cough, voice issues, and interrupted sleep cycles that rob the brain of memory-forming deep sleep. And finally, the seemingly harmless recliner habit, sleeping every night in a chair, starts as a comfort solution for pain or reflux, but can become a health trap. Semi-upright sleeping restricts deep sleep stages, limits full spinal relaxation, and reduces circulation to the legs. This encourages swelling and, in long cases, raises the risk of blood clots. Over time, the hips and core weaken from lack of full extension, balance suffers, and fall risk rises. So what feels safe in the moment can quietly shorten your healthy years. But there is hopeful news. Small, smart adjustments to how you sleep can reverse these harms. Sleeping on your side with a pillow between the knees rebalances the pelvis, maintains spinal alignment, and reduces lower back strain. This improves blood flow and cuts acid reflux. Simple alignment like this can dramatically ease morning stiffness and protect joints. The slightly elevated back, sleeper head and knees gently raised, gives your lungs and heart room to work, reduces apnea vents and reflux, and relaxes the lower back so muscles repair properly overnight. Patients who try a 30 head elevation and a small knee pillow report calmer breathing, fewer night coughs, and deeper sleep cycles within days. The starfish position lying on your back with arms relaxed out can open the chest, reduce shoulder compression, and improve upper body circulation if you use a contoured pillow for neck support. This helps ease tension, headaches, and nerve impingement that cause numbness in hands. And for many seniors, the true sweet spot is the 45 side recline, half upright, slightly turned to the left, supported by a wedge and a pillow between the knees. This posture combines airway protection, reflux control, spinal alignment, and lymphatic drainage, often restoring restorative sleep and improving memory and daytime energy when adopted consistently. The science is clear. Sleep is not passive, it's restorative work your body does while you rest. Poor posture at night forces your organs, muscles, and nervous system to fight instead of heal. Small, practical changes: a pillow between the knees, a gentle wedge under the head, choosing your left side for circulation, or shifting from recliner to a supported angled bed can translate into fewer aches, better blood pressure control, deeper REM cycles, and even improved cognitive performance over time. Before you head to bed tonight, try this. Pick one adjustment: slide a pillow between your knees, raise your upper body slightly, or experiment with the 45 side recline and note how you feel in the morning. Start slowly, always listen to your body, and check with your physician if you have specific medical conditions. If this video helped you, please show support by liking it, subscribing for more senior-focused health advice, and sharing it with a friend or family member who needs better sleep. And right now, tell me in the comments which sleep change you lines try tonight. I read every comment and I lines reply, because your best mornings could begin with one small change tonight, and your health can improve one restful night at a time.